Action of the parathyroid hormone is increased calcium and phosphate absorption in intestine, decreased calcium excretion and increased phosphate excretion in kidneys. In bone, calcium and phosphate resorption increased by high doses. Low doses may increase bone formation. The parathyroid hormone increases serum calcium and decreases serum phosphate. This consideration is true. The following statements about the parathyroid hormone are true except the parathyroid hormone increases calcium excretion and decreases phosphate excretion in kidneys. Which of the following statements about calcitonin is true? Calcitonin secreted by parafollicular cells of the mammalian thyroid is a single chain peptide hormone with 32 amino acids. Effects of calcitonin are to lower serum calcium and phosphate by acting on bones and kidneys. Calcitonin inhibits osteoclastic bone resorption. Side effect of calcitonin is hypotension. Glucocorticoid hormone alter bone mineral homeostasis by antagonizing vitamin D stimulated intestinal calcium transport, by stimulating renal calcium excretion, by increasing parathyroid hormone stimulated bone resorption. Action of vitamin D3 is increased calcium and phosphate absorption by 125 dihydroxyvitamin D3. Calcium and phosphate excretion may be decreased by 25 hydroxy vitamin D3 and 125 dihydroxyvitamin D3. Increased calcium and phosphate resorption by 125 dihydroxyvitamin D3. Bone formation may be increased by 25-24 dihydroxyvitamin D3. Vitamin D3 increases serum calcium and phosphate. This consideration is true. Route of administration of vitamin D3 is oral. Side effect of vitamin D3 is nephrolithiasis. Indication of vitamin D3 is hypophosphatemia. Calcifediol is less effective than calcitriol in stimulating intestinal calcium transport, so that hypercalcemia is less of a problem with calcifediol. This consideration is true. Indications for 125 dihydroxyvitamin D3, that is calcitriol administration, are the following except elevated skeletal turnover. The following statement refers to 125 dihydroxyvitamin D3. When rapidity of action is required, 125 dihydroxyvitamin D3 0.25 to 1 microgram daily is the vitamin D metabolite of choice, since it is capable of raising serum calcium within 24 to 48 hours. Calcitriol also raises serum phosphate, though this action is usually not observed early in treatment. It undergoes enterohepatic circulation. Which of the following statement refers to calcitriol? The combined effect of calcitriol and all other vitamin D metabolites and analogues on both calcium and phosphate makes useful monitoring of the level of these minerals especially important to avoid ectopic calcification.